We presenting a small in vitro experiment on retinal pigment epithelial cell viability with 41 gauge and 29 gauge cannula. So I do not have financial disclosures. Retinal RPE cells are a monolayer of cells in the retina, very important structure to maintain homeostasis of the retina. On the one hand, the diseases which are affected when RPE is not functioning properly involves the younger age group of retinal dystrophies. On the other hand, it is dry age-related macular degeneration. In both of them, the therapy can be injection of the RPE cells. So there are various cell types which are used for therapeutic RPE cells, human embryonic stem cells, induced pluripotent stem cell, which are called as iPSCs. The safety of the RPE product has also been demonstrated by various studies. The topic over here is the technique of delivery. Among the in the technique of delivery, the needle which is used for the technique for the delivery of the cells, that is subretinal delivery of the RPE cells. So I'll be focusing on the gauge of the needle which is used for the subretinal technique. So with this, to evaluate and understand the optimal bore dimension for injection needles or polytip cannulas for their suitability in RPE cell injection for a safe injection of the cells. It's a laboratory experimental study where adult RPE19 cell suspensions were studied. Two different bores of cannula with inner bore sizes of 41 gauge and 29 gauge were studied. To give a brief on why it is important, the average outer diameter of RPE cell is 20 to 30 microns. For a safe injection of the cells, at least 2 to 3 times the diameter of RPE cell is required, that is 60 to 90 microns. So the 29 gauge inner bore size corresponds to about 287 microns. The 41 gauge inner bore size corresponds to about 71 microns. So that's why these two needles, two different gauges were studied, one narrower and one wider. Two different cannulas of two different concentration. The different concentration is important because there's a thought that the clinician wants to inject a higher concentration of cells for better efficacy. But at the same time, when we inject more cells, there can be shear stress of the cells causing damage of the cells through the passage of the needle. So that's why two concentrations were used. This is how the cells look in adherent culture before trypsinization and after trypsinization. Trypsinization is a method where the adherent cells will become free and they are ready for injection. This is how a live and dead cell look. So the live cells will be more translucent and the dead cells will take up the dye, that is trypan blue, and look blue. In summary, how the process was. After the cells were separated by trypsinization, their assessment of cell viability and cell death index was noted just before injection. And then after that, a 0.1 ml injection of cells were injected through 41 and 29 gauge bore size needle attached to a 1 ml syringe. Post injection at 0 hour and 6 hours, cell viability and cell death index was assessed. In the results, if we concentrate, this is the cell viability index, that means how many cells survived. So in both the concentration, in both the gauges of needle, more than 90% of the cells survived at both 0 hours and 6 hours of injection. What is important is to note that in the lower concentration, in the narrower gauge needle, at the lower concentration, there was more, the cell survival was less. This is indicated even with the cell death index, where we can see that in the lower concentration, that is 2 million, if we see, the cell death index is looking more in a narrower gauge needle when compared to the other end. So, whereas when we look at the end at 6 hours, both the higher concentration and lower concentration cells survived. These are indicated by the yellow arrow. These are the live cells. In summary, over 91 to 98% of the injected cells continued to remain viable at 6 hours post-injection. This in vitro study results show that the viability of RPE cell suspension injection via 41 gauge cannula is comparable to that of 29 gauge cannula, and it maintained an average viability index of more than 90% post-injection. And we all are aware that day-to-day in subretinal procedures, we are more comfortable with more narrower needle. So this can be extrapolated clinically, that the routinely used subretinal 41 gauge cannula can be safer for RPE cell suspension delivery. Concentrated RPE cell suspensions offered better cell survival as compared to diluted cell suspension. And the cells did not undergo significant extended stress post-injection. Thank you.
Nice presentation. So how it help us in understanding the retinal diseases? Just add to.
I think, thanks for the question, ma'am. I think it is, with respect to the therapy, it will help than understanding the disease. In the therapy, as we are aware that the stem cell therapy is the one which is for retinal dystrophy as well as ARMD, the stem cell therapy. So the technique of delivery, the subretinal technique of delivery, the needle is always debated, the narrower and the wider gauge needle. So for the basic scientist part, it is that the more wider the range, the cell survival is good, because we are not providing any stress to the cells. But for us, for retina surgeons, the more narrower the needle, more safer to inject and also to maneuver subretinally. So this will help. This is just a giving